Stop.
স্যার স্টার্ট করে দিয়েছি রেকর্ডিং, জাস্ট স্টার্ট করলাম।
Okay. Now, osteology, in the osteology, the time you will be reading the osteology. In that particular osteology portion, you will be reading different type of bones, including the upper lip bones, including the lower lip bones, including the thorax, including the spine, everything. But always there is a pattern the time you will be reading a bone. Today we will be discussing what is the pattern of learning the osteology and in what phase, in what ways we will be writing in the exam. So that is the portion for today for learning the osteology. Suppose you are reading, consider a bone. A bone, it can be clavicle, it can be humerus, it can be radius ulna, or from the lower limb you are reading the pelvis, you are reading the femur or the tibia. There is always a pattern, and all of you need to follow that particular pattern of osteology. Now, what is exactly this pattern is? The time you will see a bone, in consider, I'll be showing you so many bones in front of you. There will be a lot of bones in front of you, and consider you are asked to pick up a bone. You are holding this bone by your hand. Before you hold this bone by your hand, the first things you need to know, what is the anatomical position of this bone. So the first point of understanding regarding the osteology of a bone is, the word is anatomical position. What is anatomical position? Anatomical position of a bone, it denotes, does I am holding this bone in a proper position or not? Does this is the upper portion or it is the lower portion? Does it is the anterior aspect or this is the posterior aspect? You are seeing this bone, does this is the upper or it is the lower, or I should hold the bone in this position? Which is the superior, which is the inferior? Or I need to hold the bone in this way, or I need to hold the bone in this way. This point of understanding of osteology is called as anatomical positioning of a bone. So anatomical position means the way you will be holding a bone. You might hold the bone in this position also, and you might describe the bones. But does it is the right way? That means you need to understand which is the superior aspect, which is the inferior aspect. Again, you can hold the bone in this way also. You might tell which is the anterior aspect of the superior or the anterior surface, which is the posterior surface. Of course, the time you will be holding the bone, the superior aspect should be towards the upper side and the inferior aspect towards the lower side. Or the anterior side is facing towards the person to whom you are showing, towards the anatomical position, and the posterior surface is supposed to be towards the back. That is what's called as a anatomical position. This is, those who are writing, they can write down the points. This is called as a anatomical position of holding a bone. Number two is side determination. The second point, side determination. What do you mean by the word side determination? Can anyone guess what is side determination? Anyone of you? You bolte parbe?
So whether it's a ventral side.
Exactly. That means I am holding this bone. This might be the right side bone. This might be the left side bone too. But how I will decide this is the right side or the left side? There is few anatomical landmarks via which you will understand which side is the bone. Either it can be a right side bone, it can be a left side bone, but in this particular bone, there are few points which denotes that this is right side or the left side. There are few surfaces there are few groups, there are few prominences which denotes which side this bone is. That is what's called as side determination. So side determination is the point where we will understand which side is the bone. Does it is the right or the left? That is the second point of understanding from the osteology of a particular bone, that is the side determination. So the first one, anatomical position. The second one, side determination. Coming to the third point. The third point of understanding is ossification centers. What do you mean by the word ossification? Ossification কথার মানে হলো how a bone used to have a growth, or how the part or which part of the bone used to have a growth. In each of the bones, there is mainly of two types of ossification. One is primary ossification centers, and the second one is the secondary ossification centers. All the ossification centers are denoted as a years, means within how many years your bone is getting mature. When you were small, of course, the height of the bone it was not same what you are having now, because your bone is growing and having the maturation. That's what is called as a ossification. That means ossification center is mainly of two types. One is the primary ossification center and the secondary ossification center. The primary ossification center is when the bone will start ossifies from that intrauterine line till the particular age. This is varies from each and every bone. For some bones, the primary ossification years are 3 to 5, some till 7, some till 12, and then the secondary ossification center starts. And once the secondary ossification overs, the height of the bone will never regrow. That is the end of the ossification. That means if for this particular bone, the age of the humerus, I'm holding the humerus, and if particular age of the humeral ossification is 17 to 20 years, after that the humeral bone will not be there. That is the end of the ossification. That's what it's called as a primary ossification and the secondary ossification. In a particular bone, there is a different type of ossification centers. In a particular bone, there is a different type of ossification centers. Primary ossification center might be in the epiphysis, diaphysis, near the sap, near the neck. So you need to remember for each of the bones. If I am holding the scapula, for this particular bone, you will understand the ossification center is in a different area. If I am holding the radius and the ulna, you will be seeing the ossification center in the different area. So in this whole skeleton, whatever the bone is, all the bones you will see as a separate ossification center. Some bones ossification center within the 3 years, like clavicle, the primary ossification center starts. So some bones is having a late stage ossification centers. And you need to remember for each bone what is the primary ossification age and when the secondary ossification age ends. মানে কখন গিয়ে at which time the ossification ends. That you need to remember. That is the third point. You will be remembering where is exactly the ossification is. And that's the third point of the osteology portion. The fourth point is the surface and the border. Now, what is exactly the surface and the border is? If you see a bone properly, so I am holding the bone, humerus. So you can see there is few borders, that means there is few lines present in this region. There are few lines present in this region. All the lines is called as a border. We are having medial border, we are having the lateral border. So different type of borders, mainly there is a different type, like 3 types of borders is present, respective of different bones. Mainly the long bones is having this particular borders. And in between each border, we are having a surface. Surface means it's a flat region, and that's what is called as a surface. And that is the difference between the border and the surface. Border is these lines. These lines are the borders. And these all are the surfaces. In between two borders, there is a surface. Mainly we are having medial border, lateral border, we are having anterior surface, posterior surface, lateral surface, medial surface, mainly for the long bones. That is the 4th point you need to remember from this particular part of osteology. That is what border and surface. The 5th point. So we ended up with the 4th point that we'll be learning for each bones. The 5th point is the bony landmarks. What is bony landmarks is? Phony Landmarks is a projection of a bone. This is the original bone I am holding in my hand, and this is the head of the humerus. We are having few of the landmarks like tubercles. Again, we are having the epicondyles and the condyles over here for the lower end of the humerus. We are having few grooves on the posterior aspect. We are having few notches in this region. All the projection, what it's called as bony landmarks. All the projections, you can see the tubercles, you can see the head, how it looks like. Again, you can see the projected bony parts. We can palpate on our own elbow also, the projected region, we can palpate this also over here. So these all what's called as a bony prominences. Under this bony prominences, also you have to read there are few groups. The word groups means there is some hollow spaces to hold some of another bone. So how many groups? What are the names of the groups? That also you need to remember under this 5th point. So this is the first 5 points what you need to remember. So once more we will, because on the first, what is the first point we read? আমরা প্রথম পয়েন্টে কি পড়েছিলাম?
Anatomical position.
Anatomical position. What is the second point we read?
Side
determination. That means which side is the bone? Either it is the right side bone or it is the left side bone. The third point, what do we read?
Ossification centers.
Very good. That means ossification center. When does the bone is getting ossified? What is the primary ossification center of the bone? What is the secondary ossification center of the bone? That you need to remember. What is the 4th point?
Surface and
Surface
border.
Surface and border. That means if this is the bone, how many border is there and how many surface is there for a particular bone. That is the 4th point, surface and border. Come to the 5th point. What I told?
Bony landmarks.
Bony landmarks. The meaning of the word bony landmarks means for that particular bone. Suppose I am holding this scapula. We are having lot of bony landmarks. We are having coracoid process. We are having acromion process. We are having the spine of scapula. These all are called as a bony landmarks. Again, if I am holding this scapula, you can see the surfaces. Few are the costal, few are the dorsal. We are having the borders, medial, lateral. So we are having a lot of things for that particular bone. So it differs from bone to bone. It will be not same for each of the bones. Sometimes humerus is having something else, and the femur might have something else. The tibia might have something else. Your radius and the ulna might have something else. So that is what's called as surface and bony landmarks. Done. So that is the 5 points we read. The sixth point, what you need to remember from this is the muscle attachment. Muscle attachment means, you people already started with the lower limbs, you people know. Consider if this is the bone and this is the upper end of the humerus. Which muscles is to come or which muscle is to get originated or insert from that particular part. Whenever you will be reading the muscle attachment means some of the muscle is coming and getting attached over here. Some of the muscles are starting from here. So that is the origin. Which muscle is getting started from here, or the tendon of the particular muscle is getting started from here. That is the origin. And some of the muscle is coming and inserting. That is the insertion. So that is the 2 point. Again, you need to remember under the division of the muscle attachment. This muscle attachment, it can have for the superior surface, like you might tell, like the nape region of the humerus, like the greater tubercle, like the lesser tubercle, which muscle comes and get attached, or which muscle is getting originated. Few muscles are getting originated, few muscle tendons are getting inserted. That you need to remember, like you might tell on the posterior aspect or near the lateral epicondyle or the medial epicondyle, this common tendon is getting originated. So like that you need to write. In the exam too, this type of question comes. Write down the muscle attachment from the lower end of the humerus. You need to write which of the muscle is present and getting attached from this particular region. So muscle attachment does not mean that it is only the origin, it is the insertion too. So in this particular region, which of the muscle is getting originated, or in this particular region, which of the muscles is getting inserted, that everything you need to write. That is the 6th point of understanding regarding the muscle attachment. The 7th point. Also this point separately also you have to read the time you will be reading the joint. That is the ligament. Again, the time you will be reading the joint specifically in the part of anatomy and the biomechanics. That separately again in the description part you will be reading in a detailed way regarding the ligaments. But as of you can remember few of the names of the ligaments which is attached to the bones. With the example of the lower end of the humerus, we are having the collateral ligaments. Both the sides we are having the collateral ligament, like from the medial side we are having the medial collateral ligament, from the lateral side we are having the lateral collateral ligament. So you will be reading one by one which ligaments are getting attached to that particular bone. Although under the part of osteology, you no need to write in a description, that will be reading separately the time you will be reading the ligaments, or separately the time you will be reading the joints. That is the 7th point. And the last point, that's what is called as applied anatomy. Once you will be reading all that, you will be writing few of the points under the part of the applied anatomy where you will be telling what is the clinical condition or clinical anatomy in different names, what is the clinical condition of that particular bone. So that is what it's called as applied anatomy or clinical anatomy. So under this total 8 points, so we read total 8 points, and these 8 points one by one once more we will revise so that everyone can remember from the next class that the time I will start the clavicle, the time I will start the humerus, how I will go through from each parts. We will be reading under the subheadings only, and in the exam too, you need to write under the subheadings only, not as a paragraph. So the first point we read, that is the anatomical
position.
The second point we read, that is the
Side determination.
Side determination.
Very good. Third point we read, that is the
Ossification
centers. The fourth point we read, that is the
surface and border of
border. The fifth point we read, that is the
bony landmarks.
The
Phony
6th point
landmarks.
we read, that is the
Muscle attachment.
Muscle attachment.
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 The 7th point we read, that is the
Ligament.
Ligament attachment.
and the 8th point we read, that is the applied.
Applied
Anatomy.
anatomy or
This
clinical.
is as a whole, you will be starting with each bones from the next part of understanding the osteology portion. So this is the end of the basic osteology that you need to remember from the next class. Okay, so we'll end up with this, and from the next class we will continue with the directly. We'll start with the humerus, then we'll go slowly with the clavicle. We'll be reading the radius, ulna, and the carpal bones, the upper limb osteology portion. We'll start.